everyone. My name is Leonard Samariba. I'm a doctor of physical therapy and co-owner of ProFysio Therapy. And today in this video, we're going to be demonstrating how Physio, our telerehab software, works for us to be able to rehabilitate our patients from the comfort of our own home, their own home, rather. I'd like to introduce you to my partner, John Scafidi, who will be playing the part of the patient in this video. Hey, John.
Hi guys, I'm John Scafidi, one of the co-owners of ProFysio, Lenny's business partner. I have it set up in my house, in my basement, on the Wi-Fi, so we can demonstrate what it looks like for a patient session on the patient side of things.
Perfect. And I'll be demonstrating the therapist-facing side and some of the special features that this system allows us to do for the patient from an evaluation and from a treatment standpoint. So I'll be playing the side of the therapist in this case. So just to give you an introduction of what you're looking at here on my side, what you're looking at is the therapist-facing side. Obviously, John, the patient, who we are treating today for back pain. Also, in addition to the live feed where you see John here, in the bottom left, what you see is exercise instruction, pre-recorded exercise instruction, very, very professionally done, that clearly describes what's happening for the patient to follow while they have the live interaction and feed with their doctor of physical therapy. So this enables us to view the patient, critique their exercise, you correct their form, but they also have the instructions directly from the exercise demonstration at the bottom left. John, should we play this exercise and show how you can follow that one?
Sure, and I have my screen recording, so on the video, when you look at the patient side video, you'll see the exercise on my screen, and I can control that, or Lenny can control that as the therapist. The reason we like that part of this software for the company we use, after we've tested numerous software companies over the past year, was the ability for the therapist to be able to not have to have a treatment table in their house if they didn't have it and they were at home. It's easier for the patient to be able to see exactly what the exercise looked like, and the therapist can work on cueing the patient versus only being on the floor demonstrating the exercise themselves. A lot of the programs out there are almost like a glorified FaceTime where they aren't showing the exercise. So we want to show you some of the features of how this works.
Yeah, that's a great point, John. And so, I was just trying to give an overview of the left side of my screen and what the therapist is seeing, and describing what the patient is going to see. It's worth noting that these exercises here, these exercises are prescribed by the therapist, selected from an very extensive catalog of exercises. But again, we can change them on the fly and critique the patient and give them feedback, and even demonstrate on our end if at any point we want to modify the exercise. So should we let's show them what it would look like if we followed this exercise, John, if you don't mind.
Sure. So the setup there, you can see me fine there, Lane?
Yep, that's perfect.
Okay, great.
This exercise is a high plank with a shoulder tap. We're really going to challenge the core and the rest of the body as we lift one arm off the ground in our high plank to tap the opposite shoulder back and forth. You want to remain nice and tight in the core. Let's set up onto hands and knees first. Place your hands directly under your shoulders. We're going to assume the top of a push-up. So walk your feet back a little wider than normal. Hold, and let's tap.
Nice form, John. You really look stable in the core there. I'm not seeing a lot of shifting or a lot of movement there. It looks like we're making some good progress.
One more each side.
Great.
Are you having any
Rest.
pain?
Come down to the knees. Sit back onto your heels.
Yeah.
Good job. We're going to do that 2 more times. If the feet are wide, it's a little easier. The more narrow or close together your feet are, the more challenging it'll be.
Now, on the patient side here, if at any point they want to pause the exercise, they have that opportunity to pause the exercise on their end.
Go.
So Lenny pauses it now.
One more. And rest. Good
Great.
job.
Nice work, John.
So,
Make sure you're holding that tummy really.
so as a patient, I'm able to come up to the computer and stop it. You know, there are times where that exercise might be, I'm a little out of breath here now, but it's a little challenging, and I can ask Lenny, you know, it's a real challenge for me. Lenny's guidance on that could give me some cueing to say, you know what, instead of keeping my legs straight like this, you can tell me to do the same thing, but this time I want you to put your knees down and work on the same exercise, and you can make the modification on the fly, stop the video if that one's not going to work too well for me.
Great point, John. So the exercises, to see some of the other exercises that John would see throughout the course of his session, on my end, if I click to plan here and I go to the exercises that I've selected for him, you'll see a number of different exercises there that he would be going through during his monitored treatment session. Now, at any point, if I wanted to skip an exercise because I think he's had enough or he's not responding to it particularly well on this day, I can skip the exercise and go on to the next one. And again, John can pause it on his end whenever he'd like.
Now, place your hands under your shoulders.
So
Press
John,
the tops of the thighs and the pubis firmly into the floor.
John, if you, I don't think we need to do this one. If you don't mind, we could pause this one, and I'd like to just show them some of the evaluation features, if that's okay.
Sure.
Keep the head aligned with the spine and the shoulders down and back. Slowly return back to the starting.
Thanks, buddy. So on my end here, on the right side of the screen, you're looking at some of the features that we have from an evaluation standpoint. Now, we're recording at the same time, we're recording a video on John's side, so we'll be able to show you how when he enters his session, he can actually show where his pain is bothering him today. So on the therapist side, I can see here, John, your left lower back's been causing you some pain today. Is that about right? It's what I'm seeing on my side.
Yeah. Sometimes it's across, the whole thing here. But right now I'm having it right in this area here. Comes right down into this spot, here.
Right. Okay. All right. We're gonna work on that today. Now, as far as some of the other data that we can collect on our side, if today was an evaluation, what you see here, I've clicked on the medical, John, so I'm showing them all the different past medical history that we can record here as part of the medical record, as well as functional measures. For example, if we were doing lower extremity, we have a lower extremity functional scale. We have upper extremity functional scale, NDI, and other research-based outcome measures like those. In addition, you have an ability for us to, of course, upload any documents that we have for the medical record, and the normal subjective, objective assessment and plan for the patient. Now, one of the really nice features of Physio is our ability to take pictures and take videos to record the patient's progress. For example, if John, if you and I were working on knee pain, and on day one I wanted to look at your squat mechanics, I can make a video of that and then see how that's improving over the course of your sessions. That's your squat, for example, is very, very important for some folks as they need to get back to work if their job is physically demanding. Now, John, let's pretend here that I'm evaluating you for your lower back, and so I want to show the viewer how we're going to take a video of you showing me some lumbar range of motion and how we can make that part of the medical record. So, John, if you wouldn't mind, I know you said it's been bothering you when you bend forward. Can you stand up for me? And I'm going to have you face the brick wall there on the side in your basement.
Yep. And on the patient side, it's easy enough to have a phone or a computer and just adjusting the tilt on a small table that I have it on, so that I can look back and see that I can could see myself and ask, the therapist, how does it look, to adjust the screen if need be. But if it's far enough away, usually you can step back and you have enough of an image there.
That's good there, John. Now, on my end, I'm going to click record, and I'm going to ask John, our patient, to say, John, do me a favor. Go ahead and bend and reach towards your toes. Stop as soon as you feel any pain, and let me know.
Yeah, right when I get to about there, usually I can go a lot further than that, but it feels a little bit stiff, bending to about there.
Okay, that's good enough, John. I don't want you to move past that point. I can tell you for sure with some treatment and some flexibility work, I think that's going to get a lot better. So we're going to be able to track that, okay? Every session, we're going to take a look at that. We'll take a new video, and I'll be able to show you how your range of motion is getting better. Really excited to work on that with you. So you can see there now what I've done on my side as the therapist is I'm clicking save. I'm going to make that part of the medical record. I did have the opportunity to write some narrative in there as well. Now, I can also have the ability to measure that in addition to just taking a video of the motion. So this time, John, I'm going to ask you to again, let's take a look at bending forward and stop as soon as you feel the pain. And I'm going to snap a picture of it, John, so that we can measure that and take a look at the progress over the course of your visits and your treatment, okay?
Okay.
Right about there?
Yeah, right about there.
Okay, I got it. Thanks, John. Now, on my end, by the way, John, that exercise really, really helps you out. Your range of motion is already significantly better. So on my end, you see I've taken a picture there, and I'm going to use my little tool here to measure range of motion. This is essentially our virtual goniometer. If I needed the help of using this grid, I could do that as well. And I could set my axes. So I'm going to put this one here, and we're going to grossly estimate how much of that actually came from the lumbar spine. And we could document that and save it as well. That would become part of the medical record. And again, we can measure that as John progresses throughout the course of his treatment. Really nice feature. A lot of other systems don't do that. It allows us to have those objective measures and show progress. In addition to that, of course, you have normal assessment, goals that you can set. These were just, we just typed these in before. I'm going to go ahead and delete them. Excuse me. And then again, you have exercises that can be modified, removed at any time. Great. This was another video, for example, that we took. John, I'm showing him the video now that the picture that we took when we were testing it out and looking at your shoulder range of motion as well. So just a different way of looking at it and the utility of that range of motion tool. Anything you think I missed there, John? I mean, I think that's the. I want to make sure I didn't miss anything important, but I think from a treatment aspect and from an evaluation aspect, that's kind of what we've been doing for our patients in a nutshell.
Yeah. No, I think, for us on the therapist side, for documentation, Physio's program has been great for us to be able to snap the pictures, take the videos. So when we log back in, we can review the videos. We can print out a PDF of the document where we have, the pictures with the range of motion measurements there, have the patient self-assessment, have our assessment. So it was a total package for us to do this for the patients, and the exercise component for us to be able to work with our therapists like we've done over the past, most recent few months, adding more exercises that weren't on there. We're able to shoot our own exercises that we commonly use and upload them to Physio, along with the extensive amount of exercises that are in there, so that the patient has, a more guided program, which has been perfect for us.
Yeah, absolutely. I think on the patient side, all they need is a Wi-Fi signal and either a smartphone, tablet, or computer. Most computers obviously have a camera built into them these days, and the smart mobile devices definitely do as well. We've found that it works well on all of those, and there's been some great utility in it to be able to provide value for patients. Extremely convenient, obviously. It makes it a lot easier for them to schedule when you don't have to worry about commuting in or out of the office. And it's been a fantastic way for us to connect with our patients and continue to progress their rehabilitation. John, is there anything else you'd like to add?
No, that sums it up pretty well. Hopefully, give a good demonstration. Whoever's watching the video, so you understand, exactly how it works. On the provider side that Lenny's showing, and then we also have the other video on my end, which is the patient end, of what my screen looks like while we're going through this session here.
Perfect. I want to, John, thanks for taking the time today, and I want to thank whomever's viewing this video for taking the time to watch it. We're super excited about it. We hope we can serve a lot of patients with it. Thanks so much.